Hello, I'm Christine Trevino. I'm going to be demonstrating for you today how to take manual vital signs. This is going to include a blood pressure, a pulse, respirations, and temperature. It's also going to include a blood pressure over palpation. So the first thing that I would do is I would wash my hands, and then I'm going to allow for privacy, so I'm going to pull the curtain. I'm going to ask my patient if he is okay being video recorded. Are you okay being video recorded?
Absolutely.
Awesome. All right, sir. Please verify for me your full name and date of birth.
Casey Knowles, date of birth 29 January 1992.
Perfect. All right. So the first thing that we're going to do today, Casey, is we're going to do a manual blood pressure. So this is a blood pressure cuff. I'm going to put it on your upper arm. I'm going to pump it up. It's going to be a little uncomfortable. You might feel your hand going to sleep and just the blood rush out of it, but that's a completely normal, normal reaction. I'm going to make sure I align the blood pressure cuff along his brachial artery. All right, and then go ahead and relax it. And then I'm going to turn it out. Perfect. This might be a little bit cold. I'm going to make sure that my stethoscope is warm. I'm going to use the diaphragm. Okay, a little bit of pressure. All right, Casey is 130 over 98. Do you have high blood pressure?
No, but I've drank some coffee this evening.
Gotcha. All right. So the next, with the blood pressure cuff on him, now I'm just going to perform how to do a blood pressure by palpation. So I'm just going to pump the blood pressure cuff up basically until I can't feel his pulse anymore. I'm going to feel his radial pulse. All right, and that time it was actually 124 was when that top number hit over palpation. Okay. All right, I'm gonna go ahead and switch sides here. I have a clock up on the blood pressure monitor. So I'm just gonna go ahead and I'm gonna look at that and I'm gonna assess his pulse. All right, so for the first 30 seconds, I did his pulse, which was 42, so I multiplied that by 2, so it was 84. For the next 30 seconds, I assessed his respirations. I didn't tell him I was assessing his respirations because normally when you do that, patients have a tendency to breathe either faster or try to breathe slower. So his respirations were actually 18. And now I've assessed blood pressure, pulse, respirations, blood pressure over palpation, and now I'm going to get his temperature. And it's 98.2. I would document all of my findings and then be able to transcribe into the electronic health record. And this concludes my demonstration. Have a good day.